So I think many of you have just cleared MRCOG Part 1, the result which came recently. So congratulations for that, and a huge round of applause for your hard work. So you all are preparing for Part 2, MRCOG Part 2. Any concerns, anything in particular? I'm going to talk about what is MRCOG Part 2 about, how is the syllabus, how the things covered, how we can help you to clear the exam. But is there any other thing that anybody wants to ask? I know many of you have are planning to give it again because of some reasons it was not cleared this time, or you have given it in past and you're planning to give it in July or January. Is there anything anybody wants to ask? Any particular thing? Yes, guys. Anything anybody wants to ask? Nothing? All good? You can switch on your cameras if that is fine. So it makes it a little more interactive. Yes, guys? Nobody wants to switch on the camera? No concerns? Okay, then we'll wait just for a few minutes and then thereafter we'll start the session. Yes.
Good evening.
Hi, Seema. Hi, how are you?
I'm good, ma'am. How much time do you require for MRCOG Part 2 preparation?
Okay. So, Seema, look, it all depends. But yes, the syllabus is little huge. The little vast one is there. But you know, this time or every time, whenever the people give Part 2 exam with us, many of them give it just after Part 1. So within 4 months, because now if I see there is approximately 4.5 months, or you can say, chalo, 4 months are there, good 4 months are there. So it is enough if you understand that what you need to study, what is asked in exam. Once you start reading it, automatically you come to know about that. So basically it is a little smart work, which is more important than the hard work. So 4 months are enough, but you have to dedicate yourself for that 4 months then.
How many hours per day, ma'am?
Look, hours I can't say because everybody has a reading speed. If you ask me, how do you read? I read one guideline just as if I'm reading a newspaper. For me, reading is very quick. But in that case, I will read it twice or thrice to make sure that I get something from that which is asked in exam. So everybody has their own things. Sometimes people read in one go so smartly that they know everything in and out about whatever they are reading. So it all depends, not the number of hours, but yes, in general, if I say at least 5 to 6 hours you have to dedicate daily. But that is true for everybody. Even if you are preparing for a longer time also, that is actually required. Okay.
Yeah, thank you, ma'am.
Okay. So I think we can start the session because many people have already joined and we have a start time of 9 p.m. So first of all, I am Dr. Priti Anand and I am a mentor with StudyMedic, and you all know about StudyMedic, StudyMRCOG, that how people are clearing. There are huge number of success. The people have really cleared in huge numbers this time, every time, but definitely this time the Part 2 results have been also very good. From the last 2 exams, the paper was little tough and things was little different. But I think this time many students have cleared. And as I told you, many of them were preparing only from the result of Part 1. So 4.5 months they got. So the time is not anything which will decide. But yes, your presence, your consistency till your exam is very much required. So how to start? First of all, you have to make sure that whatever you are doing, you have to do it with a lot of consistency. If you think that this topic, this module I'll cover today, I'll complete today, you have to complete it. That much dedication and that much consistency is required for the daily workup to clear the exam. Believe in yourself that if I can do it, if Dr. Priti can do it, if Dr. Soumya can do it, then you can also do it. Because everybody was sailing in the same boat as you are sailing. We are also having work, we are also having home, we are also having it, everything is same. We have commitments, you have commitments. So if we can do it, you can definitely do it. So just do it and make sure that for the convocation ceremony, you have to attend the If you don't go for the paper, part 3 paper, then at least convocation you have to attend here. So one of the most commonly asked question, like what Seema asked, what do you think that how much time I need to dedicate for my preparation? It all depends. How much time you require, as I told you, I require 3 times reading a guideline to take it from it that what is important. Some people are very smart, the one reading is enough. So it all depends upon you. But most important is the time management. You have to prioritize that, okay, this time I have these 4 months or 6 months I have for my exam. So I will cut short many things. I will limit myself for many things. Some social events, some social media interaction, I will limit myself. So I will make sure that my achievement is my plan. I'll project it as my priority. So if you do this, then I think time 2 hours is also enough. 3 hours is also more. So it all depends. Now, many of you are actually aware of the format of exam. Part 1 exam was purely an SBA, a question with the 5 options and one of them is true. Part 2 exam is little different. It has SBAs, 40% of the question, but it has more of EMQs. What are EMQs? There will be approximately, you can say 15, 16, 17, 18, 20 options. And there will be a questions, 3 questions related to these options. They will be very close to each other. I mean, they are, if there is something which they are asking about VBAC success, VBAC percentage question, like this is the question, then all the 3 questions will be related to the VBAC, other percentage than in some question, they may ask you the VBAC success rate. In some question, they may ask you the VBAC failure rate, but it will be related to the VBAC. If it is a percentage question, 3 of them will be the percentage questions only and related to the same topic. But as compared to MRCOG part 1, the questions are going to be little longer. Okay. You might get 5-6 lines good question as these are. These are the exam tested questions which are present in front of you. So the question format is little different from part 1 in the sense there are SBAs, but with the longer scenarios, with the bigger question. Similarly, majority of the paper will be from the EMQ part. And what is EMQ? EMQ is basically giving you 15, 16, 17, 18, 20 options and 3 questions related to them. And each question will have its separate answer. Clear? Any doubt for anybody? Yes, guys. Any doubt? Anybody wants to ask anything? So yes, as yes, Wasabi, good evening, dear. So as it is discussed that SBAs are there, EMQs are there. And questions related to SBAs are mainly from the etiology, natural history, some epidemiology or statistics. EMQs are mainly related with the diagnosis, investigations, management, etc. Now, where to read and from, how can we help you? Now, if you ask me from where to read, I will say read from our learning management system. Our LMS is more than enough. Definitely, if you require, you can go on to read the fresh material from the drive. But if you are very particularly covering the LMS system, it will be very, very easy to clear the exam. But then you have to make sure that you are following it. What is LMS system? Let me first of all take you through that. Just a moment, I'll just stop sharing and share again. Okay, is my screen visible to everybody? Can you see this?
Yes, ma'am.
Okay. So this is our LMS system, or you can say this is our library. This is our holy book, which we want everybody should go through and everybody should take it very seriously when you are giving the exam. So you will be given an ID and you will be logging into the library and you will get the group in which you are actually. So if you are in the 4 months group, like there was a 4 months group for January exam. So you will get everything under one roof. What all? Your daily activity schedule, which we want you to cover daily, the daily activity questions. For example, if I'm going to cover antenatal care on, say today is 15th, I'm going to cover antenatal care module in a session on 21st. So before that, I will divide the antenatal care module into topics. So I want you to cover these topics a day. First day, if I want you to cover these topics, I will give you questions related to that topic in the library. You have to go back, you have to read that topic, and you have to go back and do the questions. Now, from where to read? You can read it from the summary part. So antenatal care has summaries for all the topics which are asked in your exam. Okay. So once you go through the summaries, for example, day 1, I will give you GTG, SGA, VBAC and transmission. 3 to 4 guidelines I will give you to read. You have to read from here, the summary part, go back and do the daily activity questions. Or if you have read it already, you can do it as a priority also. You can check on how much is your knowledge by doing the questions first, but make sure that you complete the summary part, the daily questions which are given to you per module, the daily topic which is given to you per module. Devika, look, if you ask me, I'll say if you remember the summary, that is more than enough. The whole guideline, they will also not ask you in your exam, right? They also know that very specific thing they have to ask you in the exam. Correct? As you know, if when we are giving our post graduation, if they are asking something about the breech delivery, what they will ask you? There is 100% of question, how will you deliver the breech head? Correct? They will ask you that. They are least bothered about any other thing, but they are very much concerned that how will you deliver the head, the techniques which are required, or if there is a nuchal arm, how will you deliver that? Okay. So summary is actually the important part from the guideline, which at least you should know, whether you know other things or not, but that part will be asked in exam. If you want, is LMS clear? Any doubt from here? I hope it looks beautiful. Any doubt for anybody? Some important topics and hard topics, we have even made the prep videos, like for the inheritance part. That is always confusing. So what you can do, there is a preparatory video which you can see on the day when the topic is given to you. Before the session, you can also go through it. Okay, clear? Any doubt from this part, the library part, the LMS part? Anything anybody wants to ask? Hello? All good, guys? Good to go?
Yes, ma'am.
Okay, I'll just stop sharing. So this is our course library, which looks like this. It has everything. It has the session record. If you are not able to see attend the session the same day because of any emergency or something, you can go through the session PPT also. You can go through the session recording also. The 4 hours recording is also there, and the preparatory material, the presentation which the mentor has done is also there. Okay, there are some wisdom shots, like wisdom shots means, for example, if I want you to tell something about malaria in pregnancy, for example, I'll prepare a 3 to 4 minutes video and I will share it in the group, and it is also in the library. So if you are somewhere reading malaria today, so quickly you can watch through it. So you'll get an idea, okay, malaria in pregnancy is something this. So later on you can go through the summary and the questions. But these wisdom shots are very, very helpful, specifically when you are very near to the exam. So they are very, very, like, see, it's 4 minutes and whole malaria and pregnancy is there, what is important points. That also we have given to you. Okay, clear? Guys, clear? Okay, any doubt? Shall I log out from here and share the PPT? Any doubt anybody wants to ask? Okay, we have many things like the mock exams and the exam tested questions. Everything is there. You say we have it. Okay, so I'm sharing my PPT now. Okay, so this is our learning management system. So where you can read everything and everything from this LMS system. Okay. Now, if you want something to be read as advanced, as a fresh guideline, we have our drive also. Okay. So what you can do, we will provide you all the library material in the form of books, all the guidelines in the form of marked guidelines, some unmarked guidelines, and exam essential questions in your drive. This drive access you will get once you enroll for the course. Clear? Yes, guys. Clear, everybody?
Yes.
Okay. What to do? What should I do once I join the course, or if I'm not joining also, if I'm planning to prepare for part 2? Make your proper schedule. We will give you our schedule for the students who are going to join us. In case if you are not joining, or if you want to follow something else, then make your schedule and stick to it. Make full use of the course library and the LMS system. Full use. Even if you are not doing books, you can ask students who have cleared. They were the students, some of them haven't touched anything except the LMS system, except our sessions and the LMS system. Make yourself very particular and consistent by doing daily workup, whatever has been given to you, daily topics which are given to you, daily question bank which are given to you. Make sure you make a balance between a theory and question. You can never clear this exam by reading the guidelines only, until and unless you apply it in the questions, because EMQs are very tricky. They are sometimes very difficult to cross EMQs, and maximum students lose the exam because of EMQ part. Yeah. Guidelines are covered, Devika. Mostly the question paper of MRCOG is related to the GTG guidelines, NICE guidelines, and their last 3 years talks. So everything will cover in the sessions. And regarding the books, SBS and EMQ books, we will give you more SBS and EMQ and updated ones than the books. That I can assure. The library has 2,000 to 3,000 plus questions. So even if you don't do books, you cover the library as a wholesome, you'll get everything.
Thank you.
Okay. And again, I have mentioned stick to the schedule means be consistent till your exam. If you're planning to give after 1 year also, please make sure that today and tomorrow also don't waste. Okay. Am I audible, guys? I'm audible, right? Aisha?
Yes, yes, ma'am. Yes.
Okay.
You're
Sujata,
audible.
yeah, Sujata, I think you can log out and check on again. Then why our support is required? Because we will give you a schedule. We'll give you the topics to be studied, which we want you to cover daily. We'll give you the questions related to those topics. We'll give you the sessions. We'll give you an extensive library, which I have just shown you. We'll make sure that whatever you read, whatever modules you cover in 1 month, you give their mock to understand how much you remember. And we'll also give you a mega mock by the end of the course. We'll also give you an exam essential mock or the recall mock. We'll also give you a talk mock. Okay. So we are going to give you everything. Again, I'll say, if you don't do anything else, if you stick to what we are teaching you, you will be able to clear the exam. That I can 100% assure you. Because that dedication, that much also if you do, the concepts will be clear. And guys, please make sure there is nothing called that this paper, if I have written this paper or somebody has given me this previous paper, the questions will come from the previous exam papers. MRCOG is not like that. Nobody remembers the correct question, first of all. The reason, it's so tiring to give the exam whole day, 6 hours, 3 hours first and 3 hours later. It's very tiring. And once you are doing the paper, you are yourself not in the state of mind to remember things. So do not believe in anybody who says, no, do the recall, you'll clear the part 2 exam. Never ever you will clear. I'm guaranteeing you that. It's always a concept which is important. If you understand that flow chart, if you understand the concept behind how is the postmenopausal ovarian cyst managed, there will be no problem in clearing any question, whether it comes today, tomorrow, or anytime. Problem is that many students keep on running in hundreds of groups to do the recall. Somebody is doing there, okay, I will also go there. You are just wasting your time. Rather than doing that, please revise your things. Nobody can clear the exam by only doing a recall, I am telling you. Neither part 1, neither part 2, part 3, it's totally a performance based. Okay. And again, I will request one thing. Do not run after joining 100 groups. It won't help. Rather, it will confuse you. Why? Somebody is doing this, somebody is doing that, and half of the time we are in the juggle or competition of seeing people. Okay, she is doing that. That group is doing this. Why our group is? We will do everything. Believe me, we'll do more than what you expect from us, and help you clear the exam. We'll not leave your hand till you don't clear the exam, but you will clear it in one go. I know that. Only thing which is required is if you decide today that I'm going to give the exam in January or I'm going to give the exam in July, then till that point, I have to be consistent daily. I have to follow the schedule which they are giving me. Or if I'm not comfortable with that, I will make my own schedule, but I will stick to that. Okay, I have talked a lot. Now, first tell me, is there any doubt? Then I will also make sure that we'll discuss some questions so that you get an idea about the exam. Yes, guys. Anything anybody wants me to repeat or tell you more or anything like that? Yes, guys.
Ma'am,
Yes.
we'll be having a group where you all will be updating us every day, and if you have any queries, you all will be attending to
Yes.
them.
You all, whatever group, whatever course you are planning to join, will be added in a Telegram group.
Okay, ma'am.
Okay.
Right, thank you.
Let me show you also our Telegram groups.
Good evening, Priti ma'am.
Hello.
I'm Dr. Vasavi ma'am.
Yeah, Vasvi, how are you?
I've lost in 1% actually. It was 65% was a passing rate, 64% I got. So what should I do for this? Like what and all the disadvantages? Like what should I do now for this 4 months so that I'll get a good percentage to pass enough, right?
Look, you just lost by 1%.
Yes,
That
ma'am.
does not mean that you were bad in studying or there was some major mistakes you have done. You have done everything correct. 1% was missing, doesn't matter. We'll clear it this time. Follow us. Follow the schedule which is given in the groups. If you're planning to give it in July, best give it in July. Do not delay it.
Yes, ma'am. Yes, ma'am. Any
We will give it in.
strategies we should follow, ma'am, for the second time when we are writing? Because it's like 4 months, we have to brush it up everything and do all the questions as soon as possible, right? Or else
Yes.
we'll be forgetting all the concepts,
Yes.
whatever we have read in Study Medic before also, right?
Yes. So do not leave anything, whatever, at least whatever now, because you will be having a little higher speed to do the things because you have already done many things. So it will be
Yes, yes,
very quick. Make sure once you have started something, start some other module along with that. So it will kind of revision for you for the second module. If you're
yes, ma'am.
planning, if we are going to do antenatal care in the group from tomorrow, make sure you start antenatal care and apart from that, some other module.
Yes, ma'am.
Okay.
Yes, ma'am. Yes, ma'am. Thank you.
I'll
Thank
talk
you.
to you. Don't worry. Okay.
Okay, ma'am.
Okay. So guys, these are the groups. Like if you're planning to join 4 months, you'll be added in the 4 months group. If you're planning to join long term, you'll be added in the long term group. Later on also, we'll have small groups like intensive hour group. Very near to the exam, we make this group. And other crash course, if you join our crash course, those groups are also there. Okay. Clear, Devika?
Yes, ma'am. Yes, ma'am.
Okay.
Thank you.
Okay. So let's do some question and have a little idea about the exam format. Okay. So Devika, I think you can only answer this. Yes, go on, dear. What do you think?
Yes, ma'am. The first question, ma'am.
Yeah.
Did you?
I hope my screen is okay, guys.
Yes, ma'am.
Yes, Sujata, you're saying something, dear. Okay.
Ma'am, it's oligos
Oligo and
and at 1 month. His progressive motility. We'll have to repeat the semen analysis in 3 months, ma'am.
Yes. So the answer is
Sorry, yeah, this side. D.
D. Very good. So this
Sorry, I didn't see
patient
that.
has, yeah, this patient has problems with the count and, yes, Devika, and the motility part, right?
Astenospermia.
And the morphology part also. So this patient has oligoasthenoteratospermia.
Teratospermia.
Yeah, just a moment.
Ma'am,
guys.
somehow with this sperm analysis, I always get confused. Although I put a picture in front of my table here. When the question comes, I get confused.
Okay, 4%, 40%, and 1.5 to 2 ml, 1.5 to 2 million per ml. That is the basic thing which I remember usually. So it makes a little easier to answer.
Okay, okay.
Yeah, okay.
Thank you.
Just a moment, guys. I think there is some refresh going on in the page. So this patient has basically oligoasthenoteratospermia, and this patient, because the counts are not severely low or severely, the condition is not severely bad. So first thing what we do is we repeat the test. Okay. Anybody who thought that we can do an IUI in this question? Anyone? Anyone who thought that we should do IUI in this question? No? Everybody? Yes. Yes, Priya. Do you think that IUI was a better option rather than going for lifestyle advice and repeat analysis in 3 months?
Yeah, ma'am. I think I would have marked that only.
So here comes a little difference between their guidelines and what we practice in our scenarios or countries or whatever you say. Because they only do IUI for certain conditions. They don't do IUI for only considering that it is a severe male infertility. Male infertility is a factor. They do IUI for the patients who have a same-sex relationship, or there is physical abnormalities in the male where the intercourse is not possible, or in the case when they want to wash the sperms because the HIV positivity is there. So these are very particular indications for IUI in that country. If there is a severe problem, then they will repeat the semen analysis as soon as possible. If there is a mild problem, not very severe grade, then they will repeat an analysis, giving a lifestyle modification of it, they will repeat the analysis in 3 months. Clear?
Okay,
okay, yeah. Just a moment, guys. I think that it is stuck somewhere. Just a moment. I'll share again. Sorry, I think there is some new update on Zoom. That is why it's showing like that. No problem. So what I was saying was that if the patient has any problems with regard to the sperms, which is oligoasthenoteratospermia or oligospermia or asthenospermia, where the defects are not very bad, then ideally in these conditions, you have to first do a lifestyle modification and repeat the analysis after 3 months. Some patients who have seriously bad sperm count, then you can definitely make sure that you repeat the test as soon as possible. And those patients like oligospermia or azoospermia patient, severe oligospermia or azoospermia, you can require to do some hormone analysis also. This kind of patient will not be given any advice of IUI. The IUI is basically recommended in NICE guideline in the UK protocols among the patients who have problems in making a relationship. There is a problem in intercourse. They are in same-sex relationship, or you are planning to do something where you are going to do a sperm washing for the HIV positive patients. Patients in whom everything is normal and they are trying and trying and trying. And from the last 2 years, they have been trying and all the reports are normal. Still, they are not able to conceive. Those patients are basically a patients of unexplained infertility. So, may I know who answered IUI?
Myself, ma'am.
Yes. So, Priya, what do you think? If the patient has elapsed for 2 years trying, but everything is normal. Now, what do you think you can recommend her after 2 years?
Ma'am, after 2 years, IVF, ma'am.
Yes. So in that case also we'll not give the option of IUI. Okay. For mild male factor infertility or the patients who have unexplained infertility, all the patients who have mild endometriosis and they have tried for 2 full years and then also they are not able to conceive, then we don't give them any other option. We straight away send them for IVF. Okay. Clear everybody? Any doubt?
No, ma'am.
Okay. Okay. May I ask Seema to answer now? Yes, Seema?
Yes, ma'am.
Yeah.
Maybe a 48-year-old woman in the menstrual disorder clinic for completed 3 years history of heavy menstrual bleeding. She's a mother of 4 children, all born with normal vaginal delivery. Her menstrual cycle is every 29 days and bleeding lasts for 6 days. But recently it has become associated with clots, cervical smear. Up to date, BMI is 39. You perform a TBS, which is a bulky of 8 mm endometrial thickness and 3 intramural fibroids. Stage 1 cystocele, stage 2 rectocele, stage 2 uterine. Waiting list for benign gynecological surgery in the hospital is over. What is the next most appropriate step in the management? I don't know. Waiting list are for people.
So she is waiting for the surgery. Most likely they will do a vaginal hysterectomy.
Yes,
Right?
ma'am. BMI is,
There are other complaints also.
but her basic complaint is heavy menstrual bleeding.
Yeah, with prolapse. So
With
they decided they will do a hysterectomy.
Yes, ma'am.
So before that, would you like to do something? And if you are planning to do something, then why are you planning to do that thing?
We like to do an endometrial sampling because endometrial thickness is 8 mm and she BMI is 39.
That puts her at more risk of
Endometrial hyperplasia and C endometrium.
Very good. Very nice. Okay. So this patient who is a known case of prolapse, who is a known case of HMB, where you are going to remove the uterus and that is going to be a vaginal hysterectomy. She has a waiting list. That is a different thing. You will do her pre-op investigations, but pre-op means the blood and the X-ray, ECG, everything. But apart from that, what does she require? A very important do a endometrial biopsy. Why? They recommend that any patient who has HMB, heavy menstrual bleeding, which is persistent, intermenstrual, have risk factors for endometrial pathology. For example, the patients who are known case of PCOS, where hyperplasia is very common, or if they are obese, or if the patient was on tamoxifen, or in whom treatment was given, some medical management was given for HMB, but she did not respond to that. Or if you suspect that the reason of bleeding can be some submucosal fibroid, polyp, or some endometrial pathology, then these patients will be given always before hysterectomy will be allowed to perform a endometrial sampling, and that also no blind sampling is done. No pipple biopsy is done. It is always a hysteroscopic guided biopsy in an OPD procedure, whatever they are using, flexible, non-flexible hysteroscope, that is a different thing. But it is always an OPD based hysteroscopic guided biopsy. Clear? Everybody clear?
Yes.
Okay. So these are the type of questions for your exam. Now, I think everybody can make out the question can be very big. It's not part 1. The question can be really lengthy with everything given. So this question, they may only give you this report and they may give you this part. They might not be interested in knowing the teratozoospermia as an answer. They have given you a scenario and they want you to answer what will be the management for this couple. Clear? Yes, guys, clear?
Yes, ma'am.
Okay. So make sure now how can I be very confident in doing the questions? Only when I practice. Now, if I'm only reading HMB nice guideline, I'll never be able to understand, okay, this question I will definitely make sure there is no sense of doing anything. Let's allow her to do some pre-op investigations and go for the hysterectomy. Until and unless I apply it in this way. Only these are the tricks which are required for exam. Definitely, you require some support for that and we are always around. Okay. Now, one EMQ, let's see one EMQ. How does they go in exam? So, may I ask Afra to answer? Afra, you're there, right? Afra? No? Naisha? Naisha, are you there?
Yes, ma'am.
Yes, Naisha, go on, dear. What do you think and why do you think so?
Sorry, ma'am. I'm from StudyMRCOG.
Okay, sorry. Okay, who is our student then? Anybody who is Naisha by the name of student? Okay, nobody. Okay, Afra, you're not there? Not answering? Okay, anybody who wants to answer? No one?
Shall I, ma'am?
Yeah, sure. Go on, dear.
34-year-old woman presents with incidental finding of ovarian cyst following an ultrasound for renal colic. Ultrasound shows 30 mm thin, smooth-walled unilocular cyst. Ma'am, option H, discharge.
Yes, why?
Because all these are benign features, ma'am. Size is also less than 5 and
Correct.
there's nothing to suggest malignancy.
Correct. So any premenopausal age group lady who is having any asymptomatic ovarian cyst, which is diagnosed because she went an ultrasound for some other purpose, you do not require to treat it if it is less than 50 millimeter or 5 centimeter. If the cyst is less than 5 centimeter, you just simply discharge the patient. If this asymptomatic simple ovarian cyst is 5 to 7 centimeters in size, then you need to do an annual follow-up. Annually, you have to do an ultrasound. And if it is more than 7 centimeters, then you will require that person to undergo some type of intervention. Okay, clear?
Yes, ma'am.
Okay. Okay, now who will take the next? Thank you, Priya. Thank you so much, dear. Dr. Pradhan, somebody by the name of Pradhan is there? Avasthi, your mic is open. Would you like to answer?
Burhan.
Brahan, go on, dear. Yeah.
Second question, 36-year-old woman is seen in clinic with weight loss and abdominal pain. Ultrasound shows an irregular solid lesion close to the ovary with ascites in blood flow. These are malignant features. So she's 36. We will do C125 and calculate the risk of malignancy.
So what you will do in this patient?
CT scan also and tumor markers are also. Tumor markers C125.
Okay. So what do they say is that if the picture of the ultrasound is completely M rule, for premenopausal ovarian cyst, we use the ultrasound picture as the B rules and the M rules, where the B rule says that it is benign features, where the M rule says there is a lot of things which are closer to the malignancy. So rather than you doing that anything, they prefer that the patient who has USG saying that there are M rules, please refer them to the gynae-oncologist. Let them handle it how they want to handle it. Okay? Clear? Barheen?
Yes, yes.
Okay, I want you to take the next question to understand it in a better way.
30-year-old woman presents with bleeding following termination of pregnancy. Ultrasound is requested to look for retain products. No retain products is found, but there is an area adjacent to ovaries, multiple excisions, and focal thickening of a lesion with a solid component. Okay, so we will do tumor markers. We will do B.
Yes. So here we'll do the tumor markers just to make sure, because it was not a completely benign, it is not a completely malignant one. Can you understand the difference between the three questions? The presentation of is different. So that is why here, because there is a suspicion of the cyst may be a malignant and it is a complex cyst on ultrasound, we'll preferably do an tumor markers before we refer her. Preferably, the GCT tumor markers are done, but for the practical purpose, they even do CA125. That is why I put answer as F. Okay. So asymptomatic cyst, which I have already told you that less than 5, don't do anything. 5 to 7, annual follow-up, and more than 7, some intervention is required. Okay. Anybody who else wants to answer? One more question I have.
Shall I, ma'am?
Yeah, sure.
A 13-year-old female patient presents with pain in the lower abdomen with lumpish feeling in the lower abdomen on the left side. She had menarche at 12 years and age, and her menses were regular. There was no history of menorrhagia. She gave a history of dysmenorrhea, occasional vomiting. On examination, there was a tender lump in the hypogastric region. at the left side of the midline. PV examination was not done. USG of the abdomen and pelvis revealed uterus diadelphys was noted. The left uterine cavity and cervical canal showed hypoechoic collection in the multiple internal echoes suggestive of hematometra and hematotracheosis. The right uterine horn and cervical canal appears normal. With respect of renal anomalies, please tell what type of renal abnormality is common with the woman with the uterus diadelphys. Horseshoe kidney, normal kidneys, ectopic ureter, renal agenesis, none of the above. I think it is in between A or D, madam. I'm little not A. Horseshoe kidney or D, madam. D is rare condition. D.
No, D is commoner.
Okay, I was
Okay.
confused.
So uterine diadelphys has renal agenesis in 25% of the patients.
Renal agenesis.
Yes.
Madam, it means it is both the. I'm confused with both the kidneys or one kidney.
No, renal agenesis. It may be one side only. The patient is living.
Yeah.
Living patient will have at least one kidney.
Definitely, that's the. Both kidneys absent means she cannot lie.
Yeah. So they say that with the patients who have MRKH problems, the uterine abnormalities, there is very common to find as renal abnormalities with them. 40% cases they report have.
Renal agenesis.
Yeah, they may have renal agenesis, ectopic, horseshoe shape, or ectopic ureter. But 40% will have associated renal abnormalities, and an absent kidney is present in 12%. So it is a very high percentage.
Okay, thank you.
Skeletal deformities are also there. The auditory malformations can be there. But among everything, renal abnormalities are more commonly associated. That we also understand by the embryological process, that the more common are the renal abnormalities with the uterus abnormalities.
Uterine anomalies.
Okay. This is an exam tested question.
Yeah.
Okay. So I hope you all got an idea about the exam questions. Now, because they are little bigger, so don't get scared. They are very purely in between 3-4 lines. It will be little story only, but that is important. Okay. So make sure that by seeing a long question, I'll not get tensed, and I will prepare myself in the way that I will balance the theory and the questions part. As I told you in the very start, only reading theory will never help you clear the exam. If you read a small topic also, try to do some questions related to it. So we have many things coming up for the MRCOG preparation for the part 2 exam. So what we want you to do, our target is to make you plan and schedule everything. Make sure what you read is not confusing and it's helpful to you for clearing your exam. Whatever we give you the written summaries, we give you the broadcast, we make you practice the things. We are always there to support you, and students who have been with us, you can ask how much they are. I can say that it is a gratitude from them that they like our motivational quotes, and whatever we say to them, it's just a a little thing extra than the studies which we can give you. And definitely it is your take to take what course you want, what brand you want. But yes, I can assure you that if you join us, your journey for MRCOG part 2 will be much, much easier. Okay, so we are coming up with the long course, which target is to prepare for the January exam. We are coming up with the 4 months course for the July exam, the one which is here. We have the small courses also, the fast track course. Sometimes it is at 6 weeks or 14 days, 14 modules also. Crash courses are there in the last 2 days, and quick revision courses are always there. But now I'll not talk about the short courses. I want everybody, please focus, please think what you want to do. If you're planning to give it in July, please start your preparation and join us. Believe in us. If you believe in yourself and believe in us, you will be able to clear the exam in one go. If you plan to do the exam in January, no worries, do it with the long course. But again, don't waste your time thinking that I'll study from tomorrow or day after tomorrow. If you have decided that you are going to give part 2 exam, start it today. Okay, do not waste time. This is my only advice to everybody. Do not waste time. If you have decided, definitely you have decided, that is why you have given part 1. So do it. Do it and complete it. In next 1.5 years, your target should be, or 1 year, your target should be to give the exam and clear every part. Okay, as I told you, if we can do it, you all can do it. My MRCOG journey was 1.5 years. I gave it everything back to back and I cleared also by the God's grace. And definitely I was very consistent in studying. So make sure the only thing which can help you clear the exam is consistency. Okay. So I hope this gives you a little idea about the exam, about MRCOG part 2. And as I told you, join 4 months and give the exam. Still, if you have a doubt or if you want to delay, then join the long course as soon as possible and give the exam in January. And for both the cases, please don't waste your time. Do not waste your time thinking that I will start it from tomorrow or day after tomorrow. Start it today. Read something on, if you do, you might be not having the guideline as a hard copy. Search it from the RCOG site and please give your best of best what you can give.
Preeti
Okay?
ma'am,
Yes.
like I want to get a guidance from you actually personally. If possible, I can
I'll
talk
call
to
you.
you
I'll call you. You just drop
because
me a message in Telegram.
because yes ma'am, yes ma'am.
Okay.
Because like it was like very disheartening for one
I
person.
know, Vasavi. I know.
We have tried so much. We have attended your classes and all. We have done all the quizzes properly. Done so much. So it
That
was like
1%, they want you to be better. That is why they have done that. So don't worry.
But many talks, it was like in our exam, ma'am, which was very old talks, and we got a cervical guidelines, which were very old cervical guidelines of 2019. So in these situations, like it is very hard to do the things
But
in
that
exam
was not
also.
your deciding factor to clear the exam. Because that part, what you were not knowing, everybody was not knowing. That I can assure you.
Yes. 10 questions were from cervical guidelines, ma'am. So
Which cervical guideline you're talking about?
2019, ma'am. 2019 cervical
Cervical
guidelines, we
screening?
got it. Yeah. Yes,
No,
ma'am.
I have
Cervical
seen the
screening.
questions.
No,
I've
ma'am.
seen the questions.
We got 2019 cervical screening questions, ma'am, which
Then
was
they
not
won't,
at all.
no, then they won't
Yeah.
consider it as your pass because that may be wrongly framed. Like last to last exam, I remember there was one question which wasn't correct. The answer wasn't correct. They won't consider that. But in that case, there is some, because what I have seen, what I have got the questions from your study buddies, they were all absolutely there in your guidelines. Still, I want, if you have questions collected, I request you to submit it to me. Let me check again. Okay. And again, the questions which are hard for everybody. That is never a deciding factor for you to clear the exam. Might be that may bring you 80%, but that won't count for clearing the exam. 100% no. Okay?
Yes, ma'am. Yes, ma'am.
Okay. Yes, Jyoti, I want you to answer my query.
Hello, ma'am.
Yes. Yes, Jyoti.
Ma'am, I was asking whether to go for July 2024 or January 2025. Which would be better? I was actually planning for January 2025, but then my family members were telling to go with the flow and give July 2024. Would it be a wise decision? Will I be I'm not understanding. I'm
When did
confused.
you give your part 1 this time?
Yes, ma'am. This time I passed this time, and after that I'm I want to prepare for part 2.
Dear, if you ask me, I will tell you to prepare it right now and give. It's not a tough exam, but it is an exam of lot of, as I told you, once you start reading, you'll get an idea that what is asked in exam. It is more of smart work than hard work. So if you are okay, you are, as I told you, 4 months means these 4 months you have to dedicatedly give for part 2 then.
Yes, ma'am.
Okay. And that will always happen. If you are deciding to give in January also, I am pretty sure apart from last 4-5 months, that part you will waste only. So why to waste? Give the exam in one shot.
Very true. Okay, ma'am. Thank you, ma'am.